Hello everyone, my name is Elaine Su. Today I'm going to share a case study of general psychological problems. Here is the contents. First is the case introduction. Second is personal statement. Third is observation and feedback. Fourth is assessment and therapy. Here is the case introduction. In this case, it reports focus on case of general psychological problems which caused by a company employees' work failure and the use of rational emotional therapy to check their problems. In this counseling case, patients was laid to blame for work, make herself feel very upset. In the past month, the client has failed in efficient, anxious, unstable, anorexic, and poor sleep. The counselor diagnosed a general psychological problem. After 6 sessions of rational emotive therapy, the patient's condition exists. Jan, female, 26 years old, unmarried, a normal office worker, no religion. She lives with her parents and works for a company near her home. She was born in an ordinary family. Her father is a clerk in a company, and her mother is a middle school teacher. She is the only child in her family. The family condition is good. The parents are very fond of it, but strict to the study. Her performance has been excellent. Their own requirements are also relatively high. Jane's personality is relatively introverted, usually less recreational activities. A gentle personality has good friends. The college entrance examination because of too intense. The score is not good. She was admitted to two colleges. After graduation, she begged for home employment and worked relatively hard. We can see this table. It is Jane's results of the self-assessment before the therapy. Normal sensory perception, clear consciousness, no delusions, clear thinking, obvious anxiety, complete and stable personality. For the physical condition, no family history of mental illness, and the city hospital checked no body disease. Recently, due to a work problem, was blamed by the leadership, and then led to the mood of restlessness and lose the appetite, difficulty in falling asleep. For the social function, slightly impaired, angry at being scolded by the supervisor, so she don't get along well with the supervisor, and feel depressed when she go to work every day. As measured by SDI-19, the patient's main symptom was anxiety, accompanied by symptoms of middle depression, interpersonal sensitivity, hostility, and other factors. From two assessment scales of SDS and SAS, we can see that the result of the standard score is lower than the patient's depression boundary value 55 points. Anxiety score scores as middle anxiety. For nearly a month, the visitor felt that she was irritable, anxious, lost appetite, and had a trouble sleeping. She felt that the department supervisor blamed her for nothing, and she was very angry. But she felt that she should get along well with the supervisor, or it would be bad for her work. Here is the Jane's personal statement. After she graduated from university, she came to this enterprise to work in labor management. She also liked this position very much, and she thinks she had done a good job. Some time ago, her supervisor asked her to count the number of employees in her company. The status of this number were already confusing, and it got her into a mess. Her boss is aware of the current situation, but the boss does not understand Jane, but also accuses her. It is just deliberated against her, and Jane is really upset every day. In the counselor observation, Jane came to the counseling center by herself, just neatly, and behaved normally, both physically and mentally. Speak clearly, have self-knowledge, and the desire for help is very strong. For the college reflection, Jane worked very hard, and she seems to have been in a bad mood since she was criticized by the supervisor a few days ago. She is also a bit sentimental at work. Maybe she will complete for the position recently, and she will be fine. For the assessment and therapy, the main complaint of the patient is basically consistent with the response of others and the observation results of the counselor. The data has a high reliability, so the assessment and diagnosis can be made based on this data. According to the three principles of Guanyin phone disease and non-disease, the subjective work and the objective work of the patient are unified. The psychological activities are internally coordinated, and the personality is relatively stable. Therefore, mental disorder can be eliminated. eliminated. The main reason is that she felt angry after being scolded by the supervisor at work. So she did not get along well with the supervisor and had the mental burden and was quite painful. The section of illness was about 1 month, and her social function was slightly impaired. However, she was in good physical condition in the hospital, and her psychological tests support the results. Here is our counseling goal setting. The short-term goal is to help her relieve the current bad mood. The long-term goal is to make her change unreasonable condition with reasonable outlook on life work. Calculating method and applicable principle. According to the patient's situation, the counselor decides to use IET method to check her anxiety about the exam. IET is a psychotherapy theory and method first developed by Elise, who is a famous American psychologist in 1950s. Here is part of the conversation between the counselor and James. For the consultation process, stage 1. For the first time, consult, uh, building their consultation relationship and diagnose. And the stage 2, back to the stage 1. Um, they should treat their clients with respect and sincere attitude and establish a good consultating relationship with them through empathy and positive attention. By talking with the patient to obtain data, compare the psychological test results and other people data is to verify the diagnosis. In the stage 2, this stage includes instructing the client to relax techniques using IET method to solve problems for the client, including psychological diagnosis and clarifying the client's ABC. Comprehend assist the person to comprehend the principle of rational emotional therapy. As well as revision, counselors use a variety of techniques to make the patient modify or abandon the original irrational beliefs and replace it so that emotional symptoms can be elevated. And in the stage 3, consultation stage, in the fifth times meeting. In this stage, the participants are encouraged to apply the skills they have learned to the real life and reduce or eliminate tension through the self-regulation. In the first consultation, the purpose is to collect the general information of the patient and establish a relationship and make a diagnosis. In the second time, the purpose is to establish the consulting and let the client lean on the sofa, whole body each place is in the comfortable position. The arm is natural drop or put aside on sofa armrest, using the relaxation techniques of meditation, and ask the person to imagine themselves in the relaxing situation, such as sitting by a lake, wish to achieve the state of quiet and peace. In the third to the fifth times, to introduce the ABC theory of IET method and to help the patient find their unreasonable beliefs and replace them with reasonable beliefs. After the second consultation, the psychological counselor will give the client some homework. Ask the client to go home and practice the relaxation techniques over and over again until she can master it. Here is the table about self-rating scale of symptoms of patient after IET method compared to the self-rating scale before the counseling. We have a significant reduction in anxiety symptoms. According to the table, the depression score of the patient decreased to 43. The anxiety score was reduced to 46, with a score reduction rate of percentage of 26. The consultation was effective. The client's bad mood improved greatly during the last visit. The recent goals have been achieved. However, it is necessary to further coordinate it with the emotional counseling so as to establish the correct interpersonal skill and mentality. Thank you very much for watching today. I'm going to share this case about work anxiety, and here is my thought on this case studies. Jane, the subject of this case, suffered from the emotional problem at work. This reminds me of the case about the Kaponaki and Wallet in 2009 mentioned in the class. Among them, yelling and shouting and another person of a lower rank appeared, such as Jane. While the counselor didn't determine whether Jane would suffer from workplace bullying, but Jane did suffer from the work anxiety. Fortunately, Jane ended up using rational emotional therapy to ease her work anxiety. Through this case, I feel more the importance of the knowledge about workplace counseling. Finally, thank you very much for watching. Here is the reference for this case.